This is One-on-One. We welcome Dr. Thomas Birch, Chair of the Infection Prevention Committee at Holy Name Medical Center. Good to see you, Doctor.
Thank you. It's an honor to be here.
Well, let's talk about a few different areas. This virus, the Ebola virus?
Yes.
How serious, in the fall of 2014 as we do this program, how serious is the situation?
This is getting more serious all the time, especially for West Africa, with an epidemic that continues to grow somewhat exponentially, taking more lives and affecting larger areas, but really for the whole world because of the potential to spread.
How about the United States?
Well, there's a small chance that it could come here at this point. Travel is restricted and people are being screened, and most of the people who are affected are not of the class that they would be able to get on an airliner and fly.
What is it?
It is a viral infection that's very easily transmitted by body fluids. It causes an illness like many viral infections at the beginning, with fever, weakness, headache, sore throat, muscle aches, nausea, vomiting, diarrhea. But then it progresses to cause hemorrhage and necrosis of internal organs and death in a high percentage of cases.
High percentage?
High percentage.
Hard to survive it?
It is. It's 60% mortality in this epidemic and up to 90% mortality in previous epidemics.
Difficult to treat?
Very difficult. There's very little
resistant?
Direct treatment right
Antibiotics?
now. Well, there have been no antibiotics. There's an experimental antibody which is available in short supply, which was slated for early phase trials. So there isn't a big supply. It's not easy to produce, and it has been used, and it appears to have good effect, but not enough people have been treated to really statistically determine how effective it is. But it's not an available therapy right now for most of the people who are affected because of the limited supply.
Before we move off this topic, is there any message you want to leave to the citizens in the tri-state area and East Coast watching us right now?
Well, medical centers throughout the United States, especially those that are in major entry areas, are taking precautions to identify people who would have a travel or an exposure history and to place them into prompt isolation, and that we're prepared to treat Ebola if it would come to the United States. But overall, the risk is very low, as judged by the CDC and the World Health Organization.
Okay. Let's move to another topic. I don't think I've ever said this on the air, but I should be embarrassed to say this, right?
No, you don't have to be embarrassed to talk about this.
I don't think I ever talked to my producers about this either, but MRSA, which stands for?
Methicillin-resistant Staph aureus.
Which is a serious situation, can be serious.
It's a bacteria.
Yep.
Yes.
I have MRSA.
Yes.
And about 3 years ago, I got it and it came back again. Mm-hmm. And it changed my life in so many ways. What is it, and what do we need to know about it?
We all talk about staph and strep periodically in terms of skin infections, and staph is a common normal organism on the skin and in the nose, and it causes a large number of skin infections in general. When penicillin came into civilian use in the late 1940s, most of the staph was sensitive to penicillin. It became resistant, but researchers developed methicillin. Later, staph became resistant to methicillin, and that's where we get the term methicillin-resistant staphylococcus.
Is that why it was so
Staph
difficult?
aureus.
Excuse me for interrupting. I remember when it happened, it became very difficult to find anything to treat it.
Well, there are antibiotics that are available, and we have a few new ones even in the last 3 or 4 years that might not have been available when you were treated. We do have one prominent antibiotic named vancomycin.
Vancomycin, yeah.
Yes.
But I couldn't, there's some reasons why I couldn't take vancomycin, because I was on some other medication. But here's the thing. I remember being treated with intravenous.
Yes.
Okay. And I tell you who the doctors were, I'm not going to go into, they had the best folks. But I had no idea what this was, and they came back again, and I started finding out that in hospital, people get it in hospitals and potentially in the community.
Yes.
What's the difference?
Well, the difference is that the community-acquired tends to be sensitive to other antibiotics, but it has more virulence factors, which means it's more likely to invade and cause serious illness. Whereas the hospital strains don't have those virulence factors, but they tend to be resistant to other antibiotics. Either way, the organism can invade and affect almost any tissue in the body.
And it affects your immune system.
Well, it does, because you get so sick, and when you're sick you can't eat and you have inflammation, your body tissues are broken down a little bit by that inflammation, and so your immune system is depressed.
Let's talk about the fact that you're very concerned, and others in your field are very concerned about the abuse and overuse, if you will, of antibiotics. Talk about it.
That's a major problem right now, because in some cases we're down to last line antibiotics to treat infections that we're seeing in the hospital today. And that's one of the reasons why I grouped the subject of Ebola with resistant organisms, because we take antibiotics for granted. We've been in the antibiotic era for about 70 years, and we have dozens and dozens of antibiotics, and they've really been a miracle in the treatment of infections, as well as in supporting so many other medical technologies like transplant, immunosuppression, cancer chemotherapy, surgery, things like that all require antibiotics in case infections develop. If we come to the end of the antibiotic era, it will change all of medicine. And we have the potential for these epidemics, which come up periodically as we see. They often come into the news, whether it be MERS or SARS or West Nile or this enterovirus that's in the Midwest right now. We're hearing about them more and more frequently as we live in a denser populated world, and so we depend very much on our antibiotics, both the preservation of the ones we have and the development of new antibiotics.
So we should not be using them, quote, just in case. We should only use them when we have to.
Sometimes just in case is required, but overall it would be better if we could use less. And certainly with common colds, that's one thing that affects everyone in the community. Those viruses are not sensitive to antibiotics. Generally, they're not caused by bacteria, and we should not look to doctors to prescribe antibiotics for the common cold. That's one major area. The other is agricultural use. Probably 70% of the gross weight of antibiotics used in the United States are used for growth promotion and not for treatment of specific illnesses in cattle and chicken and sheep.
So antibiotics in our meat?
That's right, exactly. Because they're growth promoters, and these animals are kept in very tight confinement. There are high rates of infections that can spread through those areas. But in addition, the animals grow faster if you give antibiotics, even in the absence of disease. There's some debate as to what the cause of this is, but it is a proven fact, and it's been a major economic issue, and the regulation has been slow to come because of the influence of that industry.
Dr. Thomas Birch, important information about infectious disease and particularly how we're using and abusing, in some cases, antibiotics. Thank you so much.
Thank you for having me.
Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by New Jersey Credit Unions, MD Advantage Insurance Company of New Jersey, PSE&G, the law firm of Gibbons, P.C., New Jersey Manufacturers, Activus, in cooperation with the American Medicine Chest Challenge, and by Cone Resnick. Promotional support provided by the Star Ledger, powering NJ.com, and by NJ Biz, all business, all New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.